I want to end today by speaking directly to kids once again. I know many of you are in virtual school again. Many of you have made more sacrifices over Christmas, over the holidays, not seeing your friends, not seeing your loved ones. This is not easy. And I know almost half of kids across this country have gotten their vaccine from ages 5 to 12. And there are people who've probably gotten very sick from vaccinations.
We know there is a risk, a very small risk, 1 in 5,000 that may get myocarditis, for example.
We need to get more. So please ask your parents if you can get vaccinated. Getting vaccinated protects yourself, protects your family, protects your grandparents, protects vulnerable people.
Was the Pfizer COVID vaccine tested on stopping the transmission of the virus before it entered the market?
Did we know about stopping immunisation before it entered the market? No. We had to really move at the speed of science to really understand what is taking place in the market.
These documents were signed at the beginning of a pandemic, when everybody was desperate for vaccines, when companies were being told to rush vaccine production. Do testing in an unprecedented way, in a way they normally don't do it. So these companies were exposed to way higher liability, putting their products on the market than they normally would, because they didn't do the type of testing that normally takes these drugs years to come to market.
We have heard that Pfizer has now submitted for regulatory approval at Health Canada a pediatric vaccine for kids 5 to 11.
That's why these companies said, if I'm going to deliver you this product that I haven't tested in my normal way, I want to have different conditions.
And there are people who've probably gotten very sick from vaccinations.
We know there is a risk, a very small risk, 1 in 5,000 that may get myocarditis, for example.
But you know what helps lift restrictions? You know what helps move beyond lockdowns? Vaccinations.
Because they didn't do the type of testing that normally takes these drugs years to come to market.
Did we know about stopping immunisation before it entered the market? No.
When Canadians get vaccinated, including with our vaccine mandates that ensure the federal public service and anyone getting on planes or trains are vaccinated, that has helped move forward, keep Canadians safe, and most importantly, to keep our frontline health workers who've been heroes during this pandemic from being overwhelmed.
These agreements require employees of the Government of Canada that access these documents to sign confidentiality agreements. And why is that? Why is there much more redactions in these documents than in other documents? These documents were signed when everybody was desperate for vaccines, when companies were being told to rush vaccine production.
Those people are putting us all at risk.
Do testing in an unprecedented way, in a way they normally don't do it.
Those people are putting us all at risk.
These companies were exposed to way higher liability because they didn't do the type of testing that normally takes these drugs years to come to market.
Those people are putting us all at risk.
And there are people who've probably gotten very sick from vaccinations.
What do you do with someone with an allergy? What do you do with someone who's immunocompromised, or someone who, for religious or deep convictions, decides that no, they're not going to get a vaccine? We're not a country that makes vaccination mandatory.
I believe that vaccines should be mandatory, but I make a distinction, and I have always have, between someone choosing for personal reasons. Exemptions will be exceedingly narrow and, to be honest, somewhat onerous to obtain. But I make a distinction, and I have always have, between someone choosing for personal reasons. Simply having a personal conviction that vaccines are bad will not be nearly enough to qualify for an exemption to that. And someone deliberately using misinformation to mislead and scare other people with so-called facts that aren't facts at all.
A very small risk, 1 in 5,000 that may get myocarditis, for example.
That lead them to make a choice that endangers their lives and the lives of other citizens.
Did we know about stopping immunisation before it entered the market? No.
And therefore, while not forcing anyone to get vaccinated. I believe that vaccines should be mandatory for travel on planes and trains, while not forcing anyone to get vaccinated. If anyone who doesn't have a legitimate medical reason for not getting fully vaccinated chooses to not get vaccinated, there will be consequences. There will be consequences.
There will be consequences.
While not forcing anyone to get vaccinated, I chose to make sure that all the incentives and all the protections were there to encourage Canadians to get vaccinated.
Au vaccin, vous autres?
Oui, tous les deux, on a une seule dose.
Ah oui? Puis est-ce que vous êtes d'accord, vous autres, avec la vaccination obligatoire?
Oui.
Oui? Ah oui, hein? Puis qu'est-ce qu'on devrait faire avec les gens qui veulent pas se faire vacciner?
On devrait appeler la police.
Oui.
S'ils n'ont pas leur vaccin, ça peut mettre beaucoup de personnes en danger. Fait que comme le gouvernement est en train de faire en ce moment, il faut leur couper petite chose à petite jusqu'à temps qu'ils se tannent puis qu'ils se fassent vacciner.
Those people are putting us all at risk.
There will be consequences.